So Ellie, obviously we've been working together, what, for like 7 years now? 7 years. And I remember, obviously coming from an osteopathic perspective, one thing that really rung true at my uni is that people weren't very good at rehabilitation.
Yeah.
And obviously as soon as we started to work together, I realised you were doing a lot of rehabilitation with your clients.
Yeah.
Right, which obviously to great effect. So that, I take it as a sports therapist, that's something that's quite innate in your education.
Yeah, definitely. So although I do a lot of treatment, like hands-on therapy, a lot of like massage, releasing muscles through different stretches, I think that rehabilitation is really important because it means that the patient is taking control of their pain. We are reducing their pain and they are strengthening, so it's giving them a lot of confidence and also making them a lot stronger.
And was that always a key pillar of your course as a sports therapist at university?
A lot of it was based around rehabilitation. So we did a whole unit on rehabilitation, and it covered strength and conditioning, so all different weights training, stretching, everything. Rehabilitation was very important on our course.
What do you think, how do you think a patient might experience rehabilitation? What are the benefits of rehabilitation for that patient? Because obviously a lot of people will continue to go back to the same therapist over and over and over again, whether they're an osteopath, chiropractor, or whatever you want to call them. What's the benefit of rehabilitation?
I feel like it gives them like tools to be able to reduce their pain if it does flare up again, but also to make sure that they're strong enough so they can walk away here with confidence that they won't necessarily have to come back. So a lot of people that I treat tend to just come back for maintenance, and it's not because they're in pain, it's just because they enjoy the treatment or they just want to make sure that it's not coming back. But a lot of people will just bring the exercises and the rehab that I teach them into their everyday lives.
And do you notice that patients notice a difference in speed of recovery because you start to...
Definitely. So many of my clients come in and they say they've tried everything, and the one thing I say to them is, has that physio, osteopath, sports therapist given you exercises to do? 9 times out of 10 it's a no, or they've just kind of given them a sheet. They've either not done treatment and just done rehab, or they've not done rehab and just done treatment. And I think bringing the two together mean that patients just feel a lot stronger and more confident. So it's just an all-round, more holistic approach. They're becoming stronger and just leaving happier.
And what do you feel are the benefits of strength for a patient who has been previously injured or previously weak?
The benefits of strength obviously vary depending on their physical activity. So it could be basic level, when they're bending over to put on their sock, they have the strength there, their muscles, whether they're tight or not, their muscles will hold the structure together and it won't kind of bring up that pain that they're feeling. It won't bring a flare up, or it will increase power in sports, like in athletes, it will increase power.
And why do you think that so many patients, or why do you think that so many practitioners fail to bring rehabilitation into their patients' management?
I think it's knowledge. I don't think they're not teaching it on degrees, and then people are so focused on what they've learned within their degree that they don't kind of explore and see their rehabilitation. And there's not enough evidence to show that it's worked, because rehabilitation has to be taught right to the right person, and it has to be unique to that person. Because someone can do an exercise, and if they're not doing it right, then it's not going to help.
And what advice would you give to a patient who keeps seeing a therapist who just wants to manipulate them and rub their muscles and doesn't give them any preventative or any structural rehabilitation?
I would say come to Revitalize, because we all work holistically here.